Hello everyone, this is Safia Khalil, and today I'm going to discuss with you the COVID timeline analysis project that I pulled with Tableau as part of the GRIP Internship conducted by Spark Foundation. Well, we can all agree that the COVID-19 pandemic has been the greatest global crisis of our time. Since its emergence in 2019, the virus has spread to every continent except Antarctica. As the need of the hour, I present this dashboard to everyone out there who wish to know a bit more about the pandemic. So let's get started. On top of the dashboard, we can see the total number of COVID positive cases today, along with its percentage change with respect to the previous day. By using the slider, we can visualize the global spread of COVID-19 across different countries. As we all know, it all started from China, slowly spread to different parts of the world, and today, US is the country with the most number of COVID cases, with around 28 million confirmed cases and 500,000 confirmed deaths. We can also hover over the map to see individual cases and deaths for each country. We can also use this drop down to see the cumulative deaths across the world. A point to be noted is that the US having the highest number of cases doesn't necessarily mean that it's the most affected country. Because of the differences in sizes and population of other countries, it's always better to compare countries in terms of cases per million. It becomes more evident when we look at the infection rate across the globe. Yeah. Now you can see that the total cases per million in the US is just 213, while in smaller countries like St. Lucia, it's much larger than that. Another thing that we can observe is that the number of deaths compared to confirmed cases is very low in all the countries. So it's also essential to compare how fatal the virus is in different countries. That's why we can choose this option to see the case fatality ratio of different countries. This would give us an idea about the likelihood that someone who is infected with coronavirus will actually die from it. Here we can also see the top 10 countries with confirmed cases and confirmed deaths, and we can also choose any number of countries to see the individual cases or death rate in each of the countries. It's true that COVID has affected all the countries irrespective of socioeconomic differences, race, or ethnicity. But I wanted to know if there was any specific characteristic that can aggravate the spread of COVID. And the first parameter that I wanted to analyze was country demographics, like GDP, Human Development Index, life expectancy, etc. And here are the results that I found. This is a scatter plot showing how the total cases in different countries vary with respect to GDP and other country demographics. We can see that countries with higher GDP has higher number of cases, maybe because of greater mobility or social interaction between in developed countries. And similarly, countries with a higher population density also has more number of cases, which is pretty intuitive. However, it was interesting to note that countries with higher HDI, that is Human Development Index, that is very standard of living and health conditions, were also affected the same as other countries. This is a warning that, living in a healthy country doesn't necessarily protect us from the pandemic. But on a different note, countries with less median age tends to be the least affected by the coronavirus. I also wanted to know if there was any relationship between the case fatality ratio and country demographics. And except between GDP and population density, no other factors had any notable observation regarding the CFR. Unlike the infection rate, the CFR is less in countries with higher GDP. This can be because of the medical facilities provided by developed countries that can decrease the likelihood of deaths for their COVID patients. Same goes with the population density. In the next dashboard, I wanted to find out if the type of population in different countries, in terms of age, health conditions, and smoking habits, affect the number of COVID cases. And quite surprisingly, I found out that there is no connection whatsoever between the share of elderly people, smokers, diabetic prevalence, etc. in different countries. Okay, So the next dashboard analyzes the connection between COVID cases and government response, like hand washing facilities, tests per case, etc. So the first two graphs shows us that the hand washing facilities and hospital beds, when they increase, cases also increases. Even though it's a bit counterintuitive, I'd like to see them as consequences rather than causes. Because obviously when number of cases increases, hospital beds and hand washing facilities should also be increased, right? And yeah, so before going into the next graph, let me tell you what test per case is. So it's the number of tests conducted by a country to find one COVID-19 case. So it's used to measure how adequately a country is testing, and WHO suggests that 10 to 30 tests per case as a general benchmark of adequate testing. And as we can see in the graph, countries with adequate testing has a less chance of getting more number of COVID cases. In order to dive deeper, I also tabulated a percentage difference in new cases, new deaths, and new tests from the previous month for all the months since 2020. And finally, in 2021, we were fortunate enough to start vaccinating against COVID-19, and the last dashboard gives us a picture about the current status of vaccinations across different parts of the world. So the bar chart shows the trend of countries who were able to successfully vaccinate both doses of COVID-19 vaccine, and here also US tops the chart with 17 million people fully vaccinated as of today. However, when we compare the share of population vaccinated, US still has a long way to go, only with around 5% of its population fully vaccinated. Whereas Israel tops the chart, getting 33% of its population fully vaccinated against COVID-19. That's really good. You can also find any number of countries like this. Just change the number here in the box. Here you go. Perfect. To know more, we can also use this map to see how many vaccinations have been administered worldwide as of now. And to the most pressing question, does vaccinating people have any effect on the number of COVID cases? Apparently, they do. As you can see here, I've plotted the trend of both the rate of vaccination and the rate of new cases. And since the vaccination have started, there is indeed a significant decrease in the number of cases. It's really a ray of hope. Yay, way to go, people. That brings us to the end of my project demonstration, and I hope I was able to make sense. Thank you so much for watching, and let's all stay safe and healthy.